Have you ever wondered why you get gout attacks and your friends don't? What are they doing differently? Well, you are about to find out why. In this video, sponsored by Amgen, I will discuss everything you need to know about gout, including its causes, diet, lifestyle, and the limitations of current treatments. Hi, I'm Dr. Girnita, a board-certified rheumatologist who has been treating patients with gout for more than 15 years. Now, I will briefly remind you what gout is. Gout is a form of inflammatory arthritis caused by high uric acid levels in your blood. But how does this happen? Your body naturally produces uric acid when it breaks down purines, which are found in many foods and made by your body. But sometimes your body either produces too much uric acid or your kidneys can't get rid of it efficiently enough. This leads to a buildup of uric acid in your blood and eventually in your joints and other organs. When uric acid crystals deposit in the joints, they cause your immune system to attack them. That results in inflammation and what you recognize as a big, swollen, and severely painful joint. So why did you develop gout when your friends with similar lifestyles did not? Because your lifestyle alone is not to blame. Studies have shown that your genes determine up to 65% of your risk of developing gout. That's right, more than half of the reason you have gout is something you can't control. So, genetics play a big role in gout. Certain genes can affect how your body processes uric acid, making you more susceptible to gout. So, if gout runs in your family, you are at a higher risk. But what about the other 35%? That's where lifestyle factors come in. Things like your diet, your weight, how much alcohol you consume, certain medications, and what other medical conditions you have, they all contribute to your gout risk. However, it's crucial to remember that even with a perfect lifestyle, you can still develop gout if you are genetically predisposed. Now let's talk treatment. The first treatment choice is oral urate lowering therapies, or ULTs. While they can be effective, they do have limitations. Number one, they require consistent long-term use to be effective. Number two, some people may experience side effects that make it hard for them to continue to take these medicines. Number three, they may interact with other medications. And number four, in some cases, they may not lower uric acid levels enough to prevent all gout attacks. That is why it is essential to work closely with your doctor to find the right treatment plan for you. Now, let's address the elephant in the room, your diet. Diet is just one piece of the puzzle. You've probably heard that certain foods cause gout, right? Well, it's not quite that simple. While diet can affect your uric acid levels, it's not the whole story. However, as I explained to you in my other videos and in the book that I wrote about gout, certain foods like red meat, organ meats, and some seafood can increase uric acid production. Alcohol, especially beer, liquors, and high fructose sugary drinks can also raise uric acid levels. On the flip side, low-fat dairy products and certain fruits may reduce your frequency of gout flare-ups. Remember, if you have gout, you're not alone. Millions of people worldwide deal with this condition. The most important thing is to work with your doctor to develop a comprehensive management plan that works for you. Now that you understand that gout is not your fault, you may want to watch this video in which I partner with Amgen to educate you and explain the consequences of not controlling gout and how it can affect more than just your toe.